Hello, friends. I'm Dr. Amit Desai. I take lectures for FMGE and for NEET PG also, mostly in surgery. So let us look at a new MCQ in our series called MCQ4U. All right. So let's see what the MCQ tells us. So they've given us an image. So this is mainly an image-based question. Let's see. The most probable malignancy that develops in a case of long-standing goiter is. So what they've given us, long-standing goiter. And which malignancy develops in this? All right. So what is the answer? The answer is very, very straightforward. A malignancy that develops in case of a long-standing goiter is basically a follicular carcinoma. Okay, follicular carcinoma. That is the risk factor. So let us look at malignancies of the thyroid and their risk factors. So just now we saw follicular thyroid cancer. We saw follicular thyroid cancer. And what was the risk factor for it? Long-standing multinodular goiter. Long-standing multinodular goiter was the risk factor. All right. Now, the most common malignancy of the thyroid is papillary thyroid cancer. The most common malignancy is papillary thyroid cancer. And what are the two important risk factors for papillary thyroid cancer? First and foremost, the important risk factor for papillary thyroid cancer is previous history of irradiation to the neck. Okay, previous history of irradiation to the neck. Another risk factor is something called as thyroglossal cyst. Okay, thyroglossal cyst. If we look at medullary thyroid cancer, remember that medullary thyroid cancer arises from the C cells, which are also called as the parafollicular cells. Now, this can arise in three settings. Either it can be sporadic, that means there is no genetic predisposition as such, or it could be familial, or it could be a part of MEN2 syndrome. So it could be a part of either MEN2A or MEN2B syndrome. All right. So MEN2A or MEN2B. What does MEN stand for? MEN stands for multiple endocrine neoplasia. Multiple endocrine neoplasia. All right. So, as far as M2A and M2B are concerned, both of them have a problem with chromosome number 10. What is the gene that is involved? The gene that is involved is RET proto-oncogene, RET proto-oncogene in both the cases. All right. And what are the tumors that we will see, all right, in these? So in both of them, we will get medullary thyroid cancer. Okay, both these will show medullary thyroid cancer. Another tumor which is common in both is pheochromocytoma. What do we mean by pheochromocytoma? Pheochromocytoma is basically a tumor of the adrenal medulla. And adrenal medulla secretes catecholamines, that is epinephrine and norepinephrine, which is also called as adrenaline and noradrenaline. All right. Now, the third tumor is what differentiates MEN2A from MEN2B. All right. So for MEN2A, the third tumor is usually a parathyroid tumor. Whereas for MEN2B, they are usually mucosal neuromas. They are mucosal neuromas. So this is what differentiates men to A from men to B. So we saw the risk factors for papillary thyroid cancer, medullary thyroid cancer, and also for follicular thyroid cancer. This was an image-based question. You can have such image-based questions in your exam. So thank you very much. If you liked this video, then you can subscribe to our channel ADSL Academics. You can like this video and also press the bell icon so that you will get to access to other videos, okay, notifications of the other videos that we come out with. Thank you very much.